Some of the most common orthodontic emergencies, you could say, are broken brackets and poking wires. So I wanted to make this video to show you how to take care of a few of those at home to make you comfortable. The first is if you break a brace in the front. Now, the great thing is the brace would just slide back and forth on the wire, and it won't actually come off of the wire. It may, however, flip upside down or turn or move back and forth. If that movement or that turning does bother you, you can use a little bit of wax to help and hold that in place. Now, when you use the wax, you want to go ahead and break off a little piece here. Roll it between your fingers to try and get that a lot warm, kind of warmed up and pliable. And what you'll do is you'll go ahead and place that right on the brace, and that will help hold that in place a little bit and prevent that from sliding for you to make it a little bit more comfortable. Now, sometimes if you break a brace in the back, like this one, that brace will actually come right off of the wire. It may come right off. First things first, always save that brace if you can. That's a very nice brace, and we'll go ahead and make sure to use that at your next visit to get you taken care of. However, this will leave a long wire that oftentimes will poke you and bother you. Now, with that, to get you comfortable, what we recommend is a pair of nail clippers. Make sure to rinse them off and wipe them down with rubbing alcohol before you use them, and a couple of tips on how to use them. A lot of our wires can be clipped with the nail clippers. You might just have to push a little bit. You will want to stretch your cheek back and try and get as far back. Sometimes you'll be able to reach back here and clip that wire and get that off. Sometimes what you'll do is, if you can't reach all the way back there, you'll go ahead and get right in between as far back as you can and go ahead and cut that wire right there. Once that wire is cut in that area, if you have to come up further, you can go ahead and actually slide that wire out with a pair of tweezers and get that out of there so it's no longer bothering you. You'll want to make sure to try and cut it as close to the next brace as possible and as far back as possible, so that way the remaining teeth and braces stay as intact as possible. Now, another thing, so that's if you have a long piece of wire poking you, but sometimes and often, a lot of times as your teeth move, sometimes there's just a little bit of wire bothering you and poking you, as you can kind of see here, right back here. Now with that, what you would do is you'd almost use the same trick with the wax. This one, it's too short to cut at home. So you would go ahead and again, take that wax, roll that up and soften that up so that way you can mold around that brace, and you'll go ahead and push that on there where you need. Now, one of the things that really helps that stick is if you can take a Q-tip and dry off that brace before you stick the wax to it. A lot of times the wax, when you go ahead and eat, that'll go ahead and come off, and you'll have to go ahead and reapply it again to make sure it's on there and keeping you comfortable. The other thing that you might find is some of our patients have this special wire. This wire right here, it kind of ties the teeth together to prevent you from getting any spaces. Excuse me, I have to move it over. But a lot of times it's almost like a twist tie. It's tied together here. And so at your appointment, I know a lot of times we always tell you, if that comes out and starts poking you, you can make sure that you get really comfortable at home very easily. All that you want to do is take a eraser on the back of a pencil. You want to go ahead and gently push that in towards your tooth, and you can always sometimes try and push it down underneath and tuck it underneath that wire so that way it doesn't come out as easily again. Sometimes people use their finger, but the one thing that I want to say is just be careful that you're not pushing with anything very hard on that, because you may bump the brace and then end up with a broken brace. If you do, you know how to get yourself comfortable with what I just went over. But this is a way that we can kind of take care of you and get you as comfortable as possible, especially with everything that is going on right now and our limited ability to see you and take care of you with the coronavirus, the COVID-19 exposure right now. So I hope this helps. Again, I'm always here for you if you have any questions, but a lot of times with a couple of simple things at home, nail clippers, Q-tip, wax, or a pencil, you can go ahead and kind of take care of everything. And a lot of times the wax, I know we always give you some, but if you can't find some, that is always sold at your, your CVS, your drugstores, your food stores, even Walmart, your superstores, things like that. So I hope this helps a little bit. But again, I'm always here for you and can't wait to see you in office soon.